Hi, this is Dr. Serena Satcher from Treat Yourself to Health. And today I'm going to talk about why people may have insulin resistance or prediabetes. And I'm going to just talk about a few points. I would say are some top common points as to why people have prediabetes and why they're not aware of it. So many times our conventional medical doctors will check our fasting blood glucose, and that's a way that they're monitoring to see if you're developing diabetes. Now, the old recommendations use just a fasting blood glucose, but we know from newer recommendations, and we know from our experience in functional medicine and integrative medicine, that that is not the only test that we would do to see if you're developing insulin resistance, because insulin resistance is generally going to develop in the liver first, and it can show up in different ways. So one of the tests that I recommend that people ask from their doctor is to get a hemoglobin A1C. This is a test that you can look at over the past 3 months to see what your average blood sugar is. So there are other tests like liver function tests to see if you're developing fatty liver. There is also a test called glycomark. But the hemoglobin A1C costs under $10. So even if you don't have insurance, you can pay cash and you can go online to LabCorp and order it on yourself and go into the lab and get it done. You can ask your primary care doctor to order it if you have a primary care doctor. And if you have insurance, they will cover it if you have not had that test done in the past 3 months. They will limit how many you can get per year, but don't let that limit how many times per year you check it, because I just told you that you can check it for under $10, okay? So next thing is I wanted to talk about just some of the probably the top 3 reasons why I see that people have insulin resistance. And at a certain level, it's prediabetes, okay? And that can vary from lab to lab. So just check your lab and check with your primary care doctor to see what that level is. You can look it up online. I'm not going to go over that here. So the number one thing I see is stress, okay? And the stress can be from different reasons, but some of the top reasons are some type of trauma that's unresolved, and people have not addressed the emotions that it's contributing to their life, and it's affecting their lifestyle. So stress is probably number one. Number 2 would be nutrition. People are eating ultra processed food. We need to eat unprocessed whole foods all the time, okay? And we need to avoid fast food and ultra processed foods. So in America, we call it the standard American diet, which is a SAD diet. This is the reason why many people are developing prediabetes and diabetes, as opposed to what many people think is that it's genetic. It's not, it's epigenetic. And what that means is the environment that you're creating around the genes can cause the genes to flip into that disease if you're not providing the correct nutrients and if you have too much stress. The last item that I would mention that's probably one of the top reasons why I see people developing prediabetes and insulin resistance is poor sleep. So sleep has a lot of concepts wrapped up into it, like circadian rhythm, like hormonal issues, which can get really complex. And you need to have a doctor who has some awareness that this is going on, because in conventional medicine, they will ask so many questions, but they really don't have time to get into all of the different causes that can contribute to issues with sleep. For instance, many of the conventional doctors, unless they work with thyroid disease on a daily basis, they may not know that thyroid disease can affect how refreshed you feel when you wake up, and it can affect your sleep waves when you're sleeping. So generally, when people have thyroid disease that has not been adequately replaced or addressed, they may have issues with waking up feeling unrefreshed. So there are many, it's not just the thyroid, there are other endocrine and hormonal issues that can affect sleep. So it can be a complex thing. It's not simple. So those are the top 3 things I'll just quickly review: stress, nutrition, and sleep. Okay, so if you want to reach me and if you're interested in getting to the root cause of some of your health issues to reverse those, contact me on my website at treatyourselftohealth.com. Each page has a contact at the bottom of the page. You can also schedule a discovery appointment with me on the schedule page, treatyourselftohealth.com/ that's /schedule, and you can schedule a discovery visit with me. If you pay for the discovery visit, that pricing will be subtracted from whatever package price is you decide to purchase. All right, so it was great to speak with you today, and links will be provided below. Thank you.